Hi and welcome everyone today. We're very glad to have so many of you here in the Alte Aula at Heidelberg University. And also welcome to the hundreds of you joining us online from all over the world, from the UK, Spain, France, Switzerland, Brazil, Canada, Denmark, China, Mozambique, Scotland, Netherlands, the US, Colombia, India, and many, many more countries. Especially thank you to the ones in Belgium, where there's a public viewing event happening right now. So thank you all so much for joining us today for such an important day, the launch of the 2026 Europe report of the Lancet Countdown on Health and Climate Change. My name is Max Jungmann. I'm the executive manager of the Heidelberg Center for the Environment at Heidelberg University. Heidelberg University's interdisciplinary research center for environmental challenges, and I'm very happy to collaborate with our colleagues today. I'll be moderating, and we will hear from very distinguished speakers today, starting with some welcoming words by Professor Rohini Kuner, who I will introduce in a second, and then we will hear from Joachim Rockleff and Catherine Ton about the recent report that has been launched today and has already received a lot of media attention today. And then this will be followed by keynote speakers that will be introduced later on, and then by a panel discussion. And at the end, you will also have the opportunity to ask some questions, both here in the room and online. So this report is being launched at a crucial moment in time. Of course, when we're following the media agenda these days, we can easily despair because there are new global challenges happening every day, and you can easily get a fatigue when it comes to the next big risk, the next big challenge, whether it is a geopolitical one or connected to energy issues, and of course climate change. And climate change doesn't care about our media agenda. It continues both silently and in a loud way, and this is what we need to understand, and that's why it's so important to have the evidence base. And that's the good news. We have more and more knowledge about the global challenges that we're facing. We have more knowledge about how climate change affects our health, both in the future and today. And this is what this event today is about, to understand the evidence so that we can act to protect us, to protect the planet at the same time. And there are positive news happening as well. They often get covered up by the negative news that dominate the agenda. If you look at global greenhouse gas emissions, there are in many parts of the world actually slowing down, or we have seen peaks, especially in the European Union, as the emissions gap report has shown that in the EU emissions have been reduced for the past years. And there are developments happening all over the world, especially in China, with the huge growth in renewable energy. So in terms of the mitigation side, it's not all negative. And in terms of the adaptation side, we also see that we have a much better understanding of the challenges that we're facing. We have more knowledge, we have more frameworks, more infrastructure, and we're getting ready to prepare better. Still, the urgency to act is more important than ever, and that's also what today's event is about, that we're looking at the facts and figures and understanding how we can act so that we have ownership over the challenges that we're facing and that we're not staying in a state of fear or anxiety, because that's never a good place to act. We're here to send a strong signal that academia matters, that science matters, and that we're moving forward with the knowledge and the action at the same time. And with that, I'm very happy to introduce Professor Rohini Kuner, the Vice Dean of the Medical Faculty at Heidelberg University, who studied pharmaceutical biotechnology at the University of Mumbai in India and earned her doctorate in 1994 at the University of Iowa in the US, and then moved for a postdoctoral researchship at Max Planck Institute of Medical Research in Heidelberg, then also worked at BASF Links, and from 2002 on led the DFG-funded Eminöter Group at the Institute of Pharmacy at Heidelberg University, where you habilitated in 2005. And since 2006, you are the professor of pharmacy and toxicology, and you are very distinguished, have received ERC advanced grants, and in 2024 also the Gottfried Wilhelm Leibniz Prize. So thank you so much for making the time to join us today, and we're very much looking forward to your welcoming words.
Ladies and gentlemen, distinguished colleagues, dear guests, on behalf of the Faculty of Medicine, it is a great pleasure to welcome you to Heidelberg for the launch of the 2026 Europe report of the Lancet Countdown on Health and Climate Change. And I'd like to really most warmly congratulate my colleagues, Andreas Rocklev, Max Jungmann, and their colleagues for putting together this absolutely sensational and very, very important program. So thank you, this is so important. As Vice Dean for Research of the Medical Faculty, I'm very pleased to open an event that puts health at the center of the climate discussion. Because climate change is not only an environmental or economic issue, it is increasingly a major threat to human health. The Lancet Countdown Europe is absolutely the most remarkable example of international and interdisciplinary scientific collaboration addressing this important challenge. It brings together experts from research institutions, very important organizations like the World Health Organizations and the United Nations to systematically assess the connections between climate change and health in Europe. Through a broad set of indicators, it examines health impacts, but also adaptation, mitigation, and wider societal dimensions. Now, this comprehensive perspective is very essential because climate change, as we already heard from Max Jungmann, affects health in multiple and interconnected ways, and the effects are already being visible in our society. So across Europe, we see that rising temperatures and increasing exposure to heat with direct consequences for morbidity, quality of life, and mortality. Environmental changes are also influencing the spread of infectious disorders, and the continued reliance on fossil fuels, of course, also contributes to air pollution, which remains one of the most significant environmental risks to health. So for us, as a medical community, this is a central concern. These developments directly affect the health and populations that we serve here. This is why the initiatives like Lancet Countdown are so important. They provide robust policy-relevant evidence and help ensure that health is recognized as a core dimension of climate change. And at the same time, they highlight an important opportunity that many climate actions can actually bring rather immediate health benefits. And I completely agree with Max that very often we hear negative news, but actually there's also lots of positive changes. So, for example, reducing air pollution will lead to measurable improvements in respiratory and cardiovascular health, and this is also being shown by studies, and more sustainable environments also support healthier lifestyles and overall well-being. This perspective, we think, is very crucial because it shows that climate action is not only about avoiding future harm, as it is commonly interpreted, but it is actually also about improving health in the present day. And at the Medical Faculty Heidelberg, we see a clear responsibility in this context. As a medical institution, our role is not only to treat diseases, but to investigate, understand, and address, and importantly also prevent the underlying causes. And climate change is therefore becoming increasingly one of the important causes that we want to look at. This has implications for all of our core missions here at the university, and particularly in medicine. In research, it requires strengthening interdisciplinary approaches that connect medicine, public health, and environmental sciences. In education, it means preparing future healthcare professionals to recognize and to respond to climate-related health risks. And of course, within our healthcare system, it calls for contributing to more sustainable and resilient structures. Now, international collaboration is essential for all of this because climate change and health impacts do not stop at national borders, of course, as you know, and therefore the Lancet Countdown Europe demonstrates really how, very importantly, how shared data, common indicators, and coordinated analyses can support better decision making across countries. I'd like to close now with a positive thought. Although it is clear that climate change is already affecting our health, it is equally evident that we are not without options. There are many solutions, and you are a very important community who is bringing these solutions to us. Also in medicine, we recognize that this really defines our role, and we would like to contribute through research, through educating, and bringing health perspective into broader discussions. Therefore, I'd like to sincerely thank all the contributors of Lancet Countdown Europe and all the participants of today's events. I wish you a stimulating and productive meeting, and I look forward to the discussions ahead. Hope you also enjoy our beautiful city. Thank you very much.
Thank you so much for these very kind and motivating words. I think they're the perfect start for today, and I really appreciate that you also highlighted the need for more interdisciplinary collaboration. And our next speaker is actually embody this interdisciplinary collaboration. And now comes the moment that you have all been waiting for. We will be hearing about the new findings and the launch of the Lancet Countdown Europe 2026 report by Professor Joachim Rocklöf and Professor Catherine Tan. Joachim is a Alexander von Humboldt professor here at Heidelberg University, and he is interdisciplinary by nature. He's a mathematician and an epidemiologist at the same time. And Catherine Tan is from Barcelona here today, and she is at the Institute of Global Health, and both are the co-chairs of the Lancet Countdown in Europe report. So I'm very pleased to welcome you to the stage to inform us about the newest findings.
Thank you, Max. Thank you, Rohani. It's great to be here today, to be co-directing the Lancet Countdown together with Catherine. As Max said, I'm at Heidelberg University and Catherine is at IS Global, and we've been nurturing this report together, and also together with a large team of researchers internationally, both in Europe and beyond. We'll now present to you the key findings of the report. And as was mentioned, it's just a completely fresh report that was published at midnight, and it's the most up-to-date assessment on climate change and health in Europe, I would say. It's also a comprehensive assessment with a lot of deep knowledge in the different scientific topics that the indicators in the report measure. We have 43 contributing organizations and more than 60 contributing researchers into the report to guarantee that we have the most up-to-date and the best indicators to describe the changes as possible. The countdown, the Lancet Countdown activity is not a new one. It's been going on for 10 years. We've been developing indicators, trying to span the development to monitor where we stand in terms of climate change and health in Europe and globally over those last 10 years. It's been really successful, leading into lifting health up in the Conference of the Parties, for example. The European report, seems I got stuck. The European report hasn't been going on for 10 years, it's been going on for 3 years. And we have now a number of regional centers for the countdown which do more specialized indicators for each region. And this is where the European region comes in. The report measures and monitors the development specifically in Europe, meaning that we could drill deeper into the specific questions that are more relevant for Europe, and we could also to some extent have better data and deeper understanding of what's actually causing problems or what's actually leading to solutions. The different domains of the report we divide into 5 different working groups. I'm going to present to you the 2 first working groups, which is working group 1 and 2. And then Catherine is going to talk more about working group 3 and 4 and 5. Working group 1 and 2 is on impact, risks, and also adaptation. And working group 3, 4, 5 is more about co-benefits, mitigation, economics, and also public engagement. So now to the results. The first result I wanted to show you, I'm not going to show you all of the results, and Catherine will not have time to show you all the results of the other working groups either, but just a few highlights. We do, when we track deaths and illnesses from heat-related issues, so heat exposure, we see in 2024 that we had as much as 62,000 deaths from heat in Europe, and that's unequally distributed across the north and the south. We see more absolute number of deaths in the south and also relative increases because the heat exposure is higher, and heat is also interacting with demographic transitions, so we usually tend to see more deaths and more severe impacts from heat waves and heat exposure in areas which have more elderly populations. We also, as another impact, we do see dry periods increasing in Europe, which can have systemic impacts across different sectors of society, for example, agriculture and food insecurity. There's an increasing number of areas in Europe who's actually exposed to drought conditions, 65% land areas, and there's also an increase in the number of events in many of these areas. So here, if you see the illustration, the map, you see not the same distribution as for heat, but actually more common drought conditions in around Germany, in Western Europe, and also in South Spain. So, and also Eastern Europe to some extent. So this is something that we also report on. Connected to this is the food insecurity indicator, which shows around 10-11% increase of food insecurity connected to heat waves and drought conditions, especially among low-income groups. We also see that infectious diseases are picking up, at least in their transmission potential, and it's even picking up as much as 300% for Aedes-borne diseases, tiger mosquitoes spreading dengue, chikungunya, Zika. This is something that Heidelberg itself has been exposed to because we had the introduction of the mosquito here in 2017, and last summer, there was a widespread chikungunya outbreak for the first time in France, with even clusters around Strasbourg. So it's getting closer and it's getting more intense. And this is what this indicator is showing, that this potential is increasing because climate is getting warmer and more suitable for transmission. We also see that the number of days where we need to issue heat warnings is increasing rapidly. And in the period comparing to 1991 to 2000, we see more than a 300% increase in the most extreme type of heat warning days, where most people are actually suffering severe illness or deaths from heat exposure. Particularly, the rise is strongest in south of Europe, in Spain and Italy and Greece and so on. But we also see this pattern across the whole of Europe. So no land area is actually really spared from this increase. And even Western Europe, where we're now, see substantial increases in those situations. With those words, I would like to hand over to my colleague, Catherine. I have to push this a little bit harder.
Thank you, Joachim. So in terms of our energy system and health, what our indicators show is that after 2 consecutive years of increase in coal use in Europe, largely reflecting the Russian invasion of Ukraine, we're now starting to see a decrease again. We're seeing an increase in renewable and zero carbon energy. So renewable energy and electricity generation accounted for over 21% of total energy generation in Europe. And this was more than double the share that it was in 2016. One of the features of the energy system that we highlight in the 2026 report for the first time is the role of biomass in residential heating. Despite being considered a renewable energy, biomass or wood burning is relatively inefficient. It releases more CO2 per unit energy than fossil fuels, and it's an important contributor to air pollution. What we see in our indicator is that biomass makes up really quite a lot of the total renewable energy used in Europe. So almost a third of our renewable energy is from biomass for residential heating, and its use has been increasing steadily. So we've had a 2% increase since 2016 and a 37% increase since 2004. So this indicator shows the premature mortality attributable to air pollution, specifically fine particles, broken down by different economic sectors. What we see in the power sector is really dramatic reductions in the deaths attributable to air pollution in this sector. So this has decreased by 84% since 2000, so very good news. Much of this has happened due to shifting away from dirty fuels like coal to cleaner fuels and increases in efficiency and technology. So we see a simultaneous reduction in CO2 emissions, which you can see is that red line tracking. When we look at transport, the picture is a little bit different. We do see big reductions in air pollution attributable mortality from transport, but most of this has come from end-of-pipe emissions control technology and not shifting away from fossil fuels, which still really dominates the energy source in our transport. So we really haven't seen reductions in CO2 in the transport sector. When we look at the residential sector, what we see is a slight increase, about a 4% increase since 2000 in air pollution-related deaths, and this is reflecting what we just saw in the last slide, which is the increase in the use of biomass for residential heating. You can see it has some benefit for reductions in CO2, but is really an important contributor to deaths related to air pollution. This indicator tracks healthcare sector emissions, so our health systems continue to be important contributors to greenhouse gas emissions in Europe. The healthcare sector was estimated to contribute about 344 kilograms of CO2 equivalents per person in 2022. And what the figure shows is how that per capita emissions of CO2 equivalents compares to the WHO Universal Health Coverage Index, which we use in this indicator as a surrogate for health system performance. And what this figure shows is that we have this kind of cluster of countries in the upper left-hand side, which really show an example of how it is possible to deliver a high-performing health system at relatively low per capita emissions. So you see countries there, including Portugal. It's very small on my slide, but you can see Germany is there in that upper right left-hand corner, and so these are the countries that are really leading the way in that respect. This indicator is tracking the net value of fossil fuel subsidies in Europe. They're extensive. The net fossil fuel subsidies in Europe were 365 billion in 2023, so essentially 1 billion for every day of the year. This is the second highest value since 2010, and what we do see is a decrease from 2022, which was really a big increase in subsidies, again, to shield households from the energy prices due to the Russian invasion of Ukraine. These are extensive subsidies. The net fossil fuel subsidies exceed 10% of national health expenditure in 12 countries in Europe. We do see increases in clean energy investment in Europe. This investment has grown 3% in 2024 compared to 2023 and was over 86% higher than it was in 2015, indicating some very good news. And you can see this has been particularly focused on increasing electrification and improving energy efficiency. The investment in clean energy really is several-fold higher than investment in fossil fuels, which again is very good news. This indicator is tracking engagement with climate change as a health issue. In our reports, we track how different segments of society are engaging with climate change as a health issue. We look at how individuals are engaging with it, how politicians, as well as the corporate sector. And one of the striking findings from this year's report is that engagement with climate change across these different parts of society has really dropped in the last few years. And engagement with climate change really is a health issue, so that intersection between climate change and health is still at relatively, very low levels, essentially. So the figures that you see here are from the indicator tracking engagement among individuals. What we see is that individuals continue to rank very highly health as a priority. So obviously there was a big surge during COVID, but it still is seen as an important priority. Climate change was increasing in terms of how people prioritized it for several years between 2005 and 2024, but we're now seeing that drop off, which is a worrying sign. And I should say that we see quite consistent messages when we look at engagement in these other sectors of society, so among politicians and the corporate sector. What you see in the map are basically the frequency in which social media posts from TikTok about climate change have also included some reference to health. So across Europe overall, it was 7% of TikTok messages about climate change referring to health in 2024. But you can see there's quite some variation across countries, very high engagement with health and climate change in Iceland, for example. So while we see this worrying sign of engagement with climate change dropping off and low levels of engagement with climate change as a health issue, we do see much more promising signs when we look at engagement based on climate litigation. So health arguments were detected in more than half of European climate litigation documents since 2011. And what you can see in the figure is the frequency of references to health in general, physical health, and mental health. And what's particularly interesting, I think, in this indicator is the very clear increase in references to mental health, particularly following some very high-profile litigation cases about climate anxiety among young people in 2019. So we really see a surge in mental health basically following those cases. So the key messages of the 2026 Lancet Countdown report are, firstly, climate change is already costing lives in Europe. Many of the health risks that we track in our indicators are increasing, and we see that our efforts to adapt to protect health are really not sufficient. Secondly, Europe's fossil fuel dependence is holding back progress to reduce greenhouse gas emissions, to reduce air pollution, and to reduce vulnerability to short-term price spikes by maintaining a fossil fuel-based economy. And thirdly, we do see a number of very good news messages. Many things are going in the right direction. We see clear indications of our energy system decarbonizing. We see a steady trend to phasing out coal in our electricity generation, and important improvements in air pollution and what that means for public health. So I think this indicator report shows a clear message that the transition away from fossil fuels is already saving lives, and really the message is that that needs to be supported and to be accelerated. And I'll stop there, and thank you very much.
Thank you so much, Catherine and Joachim, for this great synthesis of the report. As a reminder, the full report has been published, so if you're interested in going more into details of the findings that were just presented, you can find it online. And we will now move to the keynotes to learn more about what kind of support system we have, what is being done on the international and the national level, and we will start with a keynote on the European Climate and Health Observatory by Alexander Kazmierczak from the European Environment Agency. You are an expert in climate change and health at the EEA and coordinate the European Climate and Health Observatory, a partnership between the European Commission, the EEA, and several other organizations. And you have more than 20 years of experience in working on adaptation to climate change. Before joining the EEA, you were at the University of Manchester and Cardiff, and we're very pleased to learn more about the European Climate and Health Observatory. Thank you.
Good afternoon, ladies and gentlemen. Thank you, first of all, for the invitation to beautiful Heidelberg, and thank you for the invitation to this beautiful, great hall where one can sense the centuries of scientific excellence. And talking about scientific excellence, many congratulations to Joachim and Catherine and the whole Lancet Countdown in Europe crew for putting together this wonderful report. In the next few minutes, I'm going to talk about the European Climate and Health Observatory, and in particular, how it draws on scientific excellence like the Lancet Countdown in Europe, what synergies we can see between the indicators included in the Lancet report and also coming from other sources, and what it means for the general preparedness of Europe in terms of addressing climate impacts on health and how far we still have to go. So you might have seen the European Climate and Health Observatory portal, but it's actually much more than that. And even though today it's my name that's on the agenda, I'm actually here representing the partnership. It's a community of organizations with a stake in climate and health. We come from different worlds. We come from policy, from practice, from science, and we are trying to break the silos not just between the topics, but between what we do, and work together to address climate impacts on health. You can see that even in the management of the European Climate and Health Observatory, which is done by the Directorate General of the European Commission on Health and Food Safety, together with the Directorate General on Climate Action and the European Environment Agency. Climate, health, environment, all working together. We also work with the other European agencies on food safety, infectious diseases, occupational health and safety, as well as the general working and living conditions. We also have the 3 UN agencies in our fold working on health, migration, meteorology. We work with Copernicus on Earth observation data, and Lancet Countdown in Europe have been with us from the very start, providing a window into the scientific world. On top of that, we also work with 2 professional associations, National Public Health Institutes and the Association of Schools of Public Health in the European region, who are our window into the world of practice and education, keeping us grounded, keeping us relevant, and helping to pass the messages coming from science into the world of practice. As the Lancet Countdown in Europe report has indicated, there's been a huge surge in the knowledge on climate and health in recent years. We've seen many new research projects emerging. We have the climate and health cluster of research projects funded by the European Commission, and the future is also looking very bright. There is 170 million committed to research on climate and health in the next years. But it wasn't always the case, and that's why the European Climate and Health Observatory was set up to address the knowledge gap that emerged from the evaluation of the first EU adaptation strategy from 2013. So in 2018, the diagnosis was quite brutal. There was no sufficient knowledge on climate and health to help us address the issues. So the European Climate and Health Observatory was set up to address this gap, and its goal was solidified in the EU climate law, saying that our goal is to better understand, anticipate, and minimize the health threats caused by climate change. With our colleagues in the European Commission and the General Observatory Partnership, we thought long and hard how to unpack this aim. Where do we actually want to be by 2030 to meet this goal of understanding, anticipating, and preventing climate impacts on health? And we came up with 5 strategic objectives. The first one, allowing the observatory users to monitor where we start in terms of climate impacts on health, but also the solutions. It's really hard to press. The second objective is that we want to see a better integration of climate and health in the national and subnational policies. Thirdly, we would like the public authorities to have a greater capacity to anticipate and prevent climate-related threats to health by having access to knowledge, by having access to early warning systems, by having the skills and the capacity to act. Fourthly, the goal is to increase the climate literacy of the health community and increase their involvement in adaptation actions. And finally, what we would like to see is that the evidence-based solutions are widely known and available for everyone to learn from each other and to implement them. So in this presentation, linking to the Lancet Countdown in Europe report, I would like to focus more on the first and the fifth objective. So first of all, the Lancet Countdown in Europe plays a huge role in allowing us to monitor the climate impacts on health and the solutions implemented. Right now, my colleagues in Copenhagen are working hard, almost as hard as I'm working on this clicker, to visualize the indicators coming from the most recent Lancet Countdown in Europe report. To visualize them in a way that allows the decision makers and other users of the portal to interact with them, to see what's happening in their country or maybe even in their region. And what we particularly appreciate is then indicators that actually relate either to people's everyday reality, such as food security, availability of food, or that relate to the current political priorities, the competitiveness, the impact of climate on labor supply, that resonates with policymakers. What we also do, we include indicators and monitoring from other sources. For example, we utilize the data from reinsurance companies to see how many fatalities are being caused by flooding. And over the course of 45 years, we've seen nearly 1,200 people losing their lives as a direct impact of floods in 32 European countries. We also draw on existing data, for example, from the Internal Displacement Monitoring Center, looking at the number of people displaced by extreme weather events in Europe. And over the course of 16 years, over 400,000 people were displaced by wildfires alone. That's a huge number. We also work with the Copernicus to see what the future might bring and look at the projected number of heatwave days. The big question is, how do those actually translate into action? Our second objective is the greater integration of climate and health in policy. At the start of the European Climate and Health Observatory, we ran this analysis of how climate and health are being covered in national adaptation strategies and national health strategies. And what emerged from that analysis was that health policies actually were lagging behind in terms of, in comparison to adaptation strategies, where climate and health were covered to a greater extent. But we've seen a lot of change since then, and we need to repeat that analysis to see where we stand. We've seen, for example, that the countries reporting on climate adaptation policies to the European Environment Agency, they highlight health sector as the most or the second most vulnerable to climate impacts. And we also see among the indicators produced by Lancet Countdown in Europe that the number of health national adaptation plans has increased and is quite considerable. So there is a reason to celebrate progress being made. We can also see some progress at the subnational level. We see then percentage of European cities here based on the sample of cities reporting to CDP, that the recognition of climate impacts on health is increasing. Cities can see that actually climate poses threats to their population. And I'm really looking forward to the publication of the Lancet Countdown in Europe report focused on urban areas that is coming in autumn. And we also see from the Lancet Countdown in Europe report that just has been published that the number of climate risk and vulnerability assessments done by cities has also increased. So we have some reasons for optimism. However, how that translates into practice is another question. Our third objective is about anticipating and preventing climate impacts better. What we've done in 2024 with our colleagues from the International Association of National Public Health Institutes, we ran a survey with the public health institutes across Europe to understand which of them are carrying out surveillance of heat-related mortality and morbidity, and which countries have heat health action plans in place. If you look at those maps, the green ones are those having those in place. So if you're an optimist, you can see half of Europe that is doing well. If you're a pessimist, you can see that some countries are still not quite there. This is dying, I'm telling you. The fourth objective is on increasing climate and health literacy. A slightly outdated survey coming from the International Federation of Medical Student Associations from 2020 was showing that only about 25% of the medical schools in Europe were putting climate change on their curriculum, and in about 1/5 of the schools, the students were organizing themselves to actually learn about the subject. So this survey is old, and if anyone from the International Federation of Medical Students Association is present either here and online, I would be very happy to hear what has changed. But what it shows is that the healthcare professionals who entered into practice had very little education on climate change. The situation is better in public health, where 4 out of 5 schools in Europe include climate health on the agenda. And we are working very hard with the colleagues from the Association of Schools of Public Health in the European region to pull together then information about the various training courses and modules, and actually run also and participate in training courses for the public health professionals. And the indicators of Lancet Countdown in Europe are a key input into actually educating people about that subject. Our fifth and final objective is about making sure that the solutions to climate change impacts on human health are widely known. The first important thing to mention is, aligning with the Lancet Countdown in Europe report's message, is that it's super urgent to act. We see people being exposed to heat. We see huge inequalities in that as well. Last year, with our colleagues from the Eurofound, our sister agency, we ran a survey with 27,000 Europeans investigating to what extent they are affected by different climate impacts. We found that half of them are already feeling too hot at home. 38% are not able to afford keeping their home cool in the summer. If you look just at the top left part of this infographic, you can see a comparison between the poorest and the wealthiest respondents in being able to afford keeping home cool. 2/3 of the poorest Europeans are not able to afford keeping their home cool in the summer. That's a message that should resonate with decision makers. If that doesn't resonate, we also looked at the heat exposure of schools. We combined the data from Copernicus with location of schools and the duration of the summer holidays to see how many hot days are falling outside of the summer holiday period. And what we can see is that 16,000 schools already have within the school year at least one day exceeding 30 degrees Celsius. By mid-century, under the high warming scenario, we can expect this number to double. On top of that, schools tend to be in quite barren environments in cities. There is not a lot of green space, there is not a lot of natural cooling. So we can expect a future here where the children's health and ability to learn is affected, the teachers are affected, and yes, it does link to the competitiveness agenda if anyone needs to be persuaded about it. Our knowledge about currently implemented solutions is incomplete. Again, we've run this survey with Eurofound looking at how people have prepared for different climate extremes at home. And we see that none of the adaptation measure we ask about actually is exceeded by more than 50% of the respondents. We also ask them what responses they see in the surrounding area. And the good thing is that many of them have received warnings about climate extremes, have been subject to climate awareness campaigns. But this is a very incomplete data set. Is 27,000 people is not representative, it's based on people's perception. And the sad thing is that this is the best we have at the moment. So here I would like to ask the Lancet Countdown in Europe colleagues and the whole scientific community, please don't rest on your laurels. Please continue working on indicators that tell us the state about implementation of adaptation solutions. To finish on a more positive note, whilst we don't have a comprehensive overview of where we stand in terms of adaptation solutions in Europe, we have some very good examples that show how we can adapt. I talked about the heat exposure of children at schools and how barren the environments are. There you go, we have examples that are showing how the school environments are being greened. We also have examples that show how decarbonizing and adapting healthcare is being done, for example, in Flanders. We have examples of how infectious diseases are being surveyed and controlled by different member countries, and also, for example, how mental health is being affected. So I'm really looking forward to the next part of this event and actually hearing about the examples of the solutions being implemented. And I would like to thank you very much, and please do get in touch with any examples of solutions, but also comments and suggestions how we can do our job better. Thank you so much.
Thank you very much, Alexandra, for these great insights on where we stand in terms of the knowledge on climate change and health, which knowledge gaps exist, what you're doing about it with your colleagues and organizations, and also the positive examples of where we're developing solutions today. And with that, we will actually continue. We will hear about success stories on the national level that have been supported by the World Health Organization Europe, by Francesca Raccioppi, who is the head of the World Health Organization European Center for Environment and Health in Bonn, in Germany. We're very grateful to have you here. Thank you so much for making the time. And you are extremely distinguished. You have more than 30 years of international experience in environment and health policies and science. And you have received many awards for your work, especially on One Health. And in 2018, you were awarded the honorary doctorate by the Swedish School of Sport and Health Science in Stockholm for your leading engagement in environmental health and active transport. Thank you so much for being with us today, and we're really looking forward to your presentation.
So, good afternoon, and wow, it's really intimidating to address an audience in this place, 700 years of history and science looking upon us. It's really something. You feel really humbled and very small. But I'm here today, first and foremost, to congratulate the Lancet Countdown. Thank you, congratulations to all the scientists, the 65 scientists, 33 organizations that came together, because this report is gold for us working at the WHO. Why is it gold? Because it is the moment when science shakes hands with the policy. And this is so important for us in this region because it gives us the real ammunition that we need. Of course, the Lancet Countdown has been around for a decade, but the Lancet Countdown for Europe is much more recent. And it is a thanks to your effort that now we are able to address ministries of health in the 53 member states of the WHO European region with something that resonates very closely with them. It is very different when you bring an argument that is based on global data. People don't think that it is about your country as well. And it makes a huge difference in terms of how we communicate when we can tell, well, Mr. Minister, you know, in your country is happening like this. It is here that it is happening. It is a game changer. So thanks once again for being the game changers. When it comes to bringing a little bit of experience from the WHO perspective, let me remind you what we are about to do, what is our role in the international community vis-à-vis the member states. First of all, of course, we are together with you working to protect the health from the effects of climate change, including under emergencies. We have used, since 2023, we have been bringing the extreme weather events on the WHO Europe emergency website. Why? Because we believe that this is a good way for the member states who connect, who check the information, they are informed about the pandemics, they are informed about emergencies, to see the information that they need on the WHO emergency website. Again, it has been an important way of bringing the awareness in the ministries of health about this topic. And let's make no mistake. What you found in your indicator is absolutely true. Climate change does not come out of the top 3 priorities of any Ministry of Health in Europe, I have to say. And this is because ministries of health are concerned with the tight budgets. They are concerned with serving the population and the needs of the population under changing demographic conditions. They are preoccupied by the digital and artificial intelligence transition that they need to embrace, and the health workforce. There is a little time left to be preoccupied about climate change, unless, and this again is where we come in and where you come in, we can bring them the evidence that shows that this is one of the best possible buys for them. If you are more prepared to that, you will maintain your capacity to deliver health care when it is needed and to those who need it. If you are climate proof, you will be operational. You will not suffer from floods. You will not suffer from breaks down into the energy. If you make the right investment, you will save money. And this is an incredibly powerful argument. So if they cannot do that for a moral imperative, they can do that because now we have the evidence that shows that this is best investment. So we are trying to navigate this and to push this agenda together with the member states. And as you know, WHO is in a very privileged position. We have a strong convening power. We can call different actors. And this is what we have done by convening a year ago a pan-European commission on climate change and health. This is chaired by the former Prime Minister of Iceland and supported by Sir Andy Hines as its chief scientist. But it brings together policymakers, very senior from different fields, including a former Minister of Health from Germany, among others. And they have been tasked with looking at how comes that we are not, all what we know is not sufficient to move at the speed that is necessary. This is the task that they have tried to address over the past year. And they are about to release their conclusions and recommendations, which of course I'm not going to disclose right now here. I want to keep you thrilled and wait for the 17th of May when the Commission will reveal its findings. But once again comes a deep sense of gratitude to the Lancet Countdown, because you had a very strong standard bearer who participated, Professor Antò. He was one of the experts that the Commission interviewed throughout its very broad process of consultations. They held 3 hearings, 2 consultations. They consulted the summaries of the evidence, and the Lancet Countdown was one of the stakeholders, one of the experts that were consulted there. So thanks for being the standard bearer, but also thanks because you allowed us and you allowed the Commission to use some of the data in their, as a part of the evidence that will form the basis for their recommendations. The other thing that we are doing in the European region, and this is a political unprecedented, is that last October at the WHO Regional Committee for Europe, which is the annual meeting of all the ministries of health of the 53 member states, they adopted the so-called the European Programme of Work until 2030. This is the blueprint, the public health policy blueprint for the 53 member states. It is politically adopted, and it was excellent for us to see that climate change features prominently as one of the key pillars of this effort. So this opens up a new opportunities. But then let's look at how we are currently working with countries and in countries. And here we cover different aspects. So we are supporting them, and as I said, Europe for us is 53 member states. Nearly half of them are covered by the Lancet Countdown, but not all of them. And there is a big gap that we are trying to bridge there. And this means supporting member states into bringing health to national vulnerability assessment, bringing health to national determined contributions, for example, showing those health co-benefits that the Lancet Countdown has been highlighting. It is about supporting member states in developing health action plans, which is one of the measures that can save life, and supporting member states to embrace the agenda and become health systems that are sustainable, resilient to climate change, and more effective in the use of their resources. A couple of highlights from Central Asian republics. Turkmenistan and Tajikistan have been working with us to develop their national heat health action plans. And as I'm speaking, our regional director, WHO Director General, and many others are in Astana signing new agreements to develop partnerships that will support the work in some of the most affected areas in the Aral Sea, particularly, and in the Caspian Sea, where we are seeing an increasing evaporation. The other aspect is about supporting health systems to become more environmentally sustainable. And here, again, an example, a nice example from our experience in Romania, where we have been supporting an increasing capacity within health systems to work there. And finally, Joachim, in your first slide, you showed that it takes, there is a saying that says, it takes a village to bring up a child, right? It takes, we say here that it takes 43 organizations from all around the world to bring up a Lancet Countdown. Partnership is the essence here. And this is something very important that we are nurturing in the WHO. We have a partnership that promotes health sector climate action. At the moment, we have 11 countries, and they work like a community of practice. It is fantastic being at their meetings. Rupert, you have been hosting one of the early gatherings of the partnership. It is absolutely a place where you learn a lot, you exchange, and you can make progress together. So, closing down, coming to a close. The Lancet Countdown, we need you. We need this work. It is desperately needed. It gives us the evidence, it gives us the trend in which we are moving, and this means also promoting accountability. We can go back and say, this is what was promised, this is what was delivered. We are, with you, and we hope that working together, we will still be able to close the gap which exists. The eastern part of the region is not yet fully covered, also in terms of the evidence. And this is a gap that we hope we will be able to close in the years to come. And I will close with, this is my very last slide. It is a watch this space. Now I make a promo for the release, the forthcoming release of the updated guidance on heat health action plans, with the word of gratitude to the many of you who have contributed to this effort over several years. And we look very much forward to the release of this new guidance, hoping to put another little piece of the puzzle into a very complex and important picture. Thank you very much.
Thank you very much, Francesca, for this very powerful speech that was both motivating and informing at the same time. And I really liked your words on that it just makes economic sense to invest in a sustainable future. I think that's a very important message for all of us today. And we will continue with the national examples, starting with Germany, with Ann-Kathrin von der Haar from the Robert Koch Institute in Germany. Ann-Kathrin has been instrumental in actually making the last event work here as well, when you were still with the Center for Planetary Health Policy, and since then you've moved to the Robert Koch Institute, and you are part of the MOCA project, monitoring of climate change related health aspects. So you're working on indicators on the national level to monitor climate change related health aspects in Germany, and we're very much looking forward to hearing from you.
Good afternoon, everyone. It's a pleasure and an honor to speak here today. And I firstly want to thank Max for the kind introduction. Also, thanks to the Lancet Countdown again for inviting me, but also for really giving us legitimization at the national level for our work that we are doing. And I'm very pleased to use this occasion to, as Max said already, share some of the work that we are currently undertaking at the Robert Koch Institute. And in particular, I will introduce you to the MOCA project, which aims to develop a national indicator set for monitoring climate change-related health aspects in Germany. It's a project that is funded by the Ministry of Health, and I'd say with this, we'll dive right in. And this you have seen already. Climate change is already costing lives, and health risks are intensifying at an alarming pace. I don't think that I need to further elaborate this, as we all can read it in the current report again, and after the excellent talk we've just heard from Joachim and Katrin, I think this is very clear. And what I also find very clear is that the Lancet Countdown initiative is really fundamental. We've heard it a couple of times already today for our work, but also for laying a good foundation on climate action, as robust surveillance and monitoring is really essential to detect emerging risks. I mean, climate change is not emerging anymore, I feel like, but also to identify vulnerable populations and really inform climate action. And for me, what we, I think, also all know is that the health impacts of climate change are evident across Europe, but they manifest locally and unequally, even though climate change is, of course, a global problem and a global challenge to take. And this is why global, national, and local frameworks for monitoring should be seen as complementary rather than competing. And I think we got a few very good examples by Alexandra already, and I'm happy to maybe give you a few examples from our national level as well, and really to make sure to show or to highlight again why we need all of those levels and how it helps to contextualize our findings and how it informs our climate action. It's really hard. You were right, Alexandra. And by saying this, I would like to now take you to the national level in Germany and to the MOCA project. And just to give you a little bit of the status quo, before the MOCA project started 1.5 years ago, Germany didn't really have a centralized effort that was trying to come up with a systematic monitoring on climate change and health. There were a few initiatives, but really nothing that was putting it all together. And this is pretty much where the MOCA project came in, aiming to really develop a comprehensive indicator set to do so that is tailored to the needs and the context in Germany. And as you can probably all imagine, this is not easy. This is really complex, and building up a monitoring really requires an appropriate set of indicators. And to just give you a few examples, good indicators, of course, need to be sufficient enough to really provide us a comprehensive picture, while they also need to be specific enough to really capture climate change and health. We also have to make sure that we have robust data and that our indicators are quality assured. And what was really important to us as well is that our indicators are also tailored to the user's need, meaning, for example, policymakers, but also public health practitioners, and that it really aligns with what they're doing in their all-day life, and that we make sure that it's really used and that it informs decision-making. And last but not least, of course, we have to also look into already existing frameworks on the international level, but also on the local level and also in other sectors, and make sure that they are harmonized and complementing each other. And to give you a bit of insight how we then tried to incorporate all of those requirements into the mock-up project, I will introduce you to the key steps that we were and that we are taking within the project. And in the beginning, we started with a quite comprehensive literature search. Firstly, on indicators itself, like we were looking into the literature, but also we looked into existing frameworks already and just tried to collect everything that was there already. And in the end, we had over 350 indicators in a huge Excel list. And we had to think of some kind of way to prioritize those. And this is what we also looked at, where we got inspired by other initiatives also in other countries, how they have done it. And we also looked for like clustering frameworks that help us to like organize those many indicators. Secondly, we decided on one particular approach how to prioritize it, and that was a really stakeholder-driven approach to really make sure that it meets the needs of the users, as I was just mentioning already. I'll give you a bit of more insight in how we've done that step in a second on the next slide. And the two last key steps that we are still currently working on is after prioritizing the indicators and now having our core indicator set for Germany, we of course have to look into all of the indicators again, find the data sources, get cooperation and in contact with other stakeholders. And also we are developing a few new indicators. And last but not least, and I think this is really crucial, we also integrate those indicators in our general German Federal Health Information System, which is basically a website with the focus on non-communicable diseases, where we have great visualizations. And I think that's really important that this topic will be evident there. As said, I want to just give you a bit of insight in how we've done the process. And as you can see by the icons, we had 4 consecutive consultation rounds that we conducted to prioritize our indicators, starting with an internal consultation with experts at the Robert Koch Institute. 27 participated, and we started with our over 300 indicators. Managed to prioritize 145 indicators, and then went into 2 rounds of online surveys with national stakeholders from various areas, very interdisciplinary, from policy, practice, but also science. And as you can see on the slide, we had quite good response rates that we were not expecting, honestly, and we were super happy that people were so involved and so engaged and really supported our work, because those surveys took more than half an hour, and I mean, time is limited, so we were really happy about that. And we managed to prioritize 50 indicators and conducted a final consensus workshop with selected national stakeholders that really aimed to finalize the prioritization phase, but also to really get consensus on a final indicator set that then consisted of 35 core indicators. And as also today, the time is limited, I can't really introduce you to all the 35 indicators. So this is the framework that we developed, adapted from what we found in the literature, but also a bit iteratively on our work that we have been doing within the prioritization process. And as you can see on top of the framework, there are climate drivers and environmental state and proximate exposures. Those are, of course, crucial indicators that we also collected within our literature search, but that we didn't put into the prioritization process. That's the reason why they're a bit gray here. And then we have the big domain of health outcomes, for example, cross-cutting health indicators such as health burden due to climate change. Then we have non-communicable diseases and infectious diseases. And in that domain, we prioritize 23 different indicators. And then on the left, on the right side of the framework, you see individual risk and resources consisting of, for example, indicators tracking health and climate change behavior, but also vulnerability factors. And then closely related to that, of course, structural risk and resources, looking more into the environment around people, for example, green infrastructure. And there we prioritized 5 indicators. And last but not least, I would like to highlight again the complementary value of 2 different monitoring frameworks or systems. With an example from the Lancet Countdown Europe, from the current report that we have seen already in Joachim's slide, but this is just the part of the German, the German map, and it shows the change in heat-related mortality between 2015 and 2024 compared to 1991 and 2000. And we see that, for example, the state of Baden-Württemberg, where we're currently in, where Heidelberg is located, as well as the eastern part of Germany, is facing rather big changes over time. And as heat-related mortality, of course, is just the tip of the iceberg, it is also important to look what happens before, as it really informs us in how to prevent those mortality in the first place. And there's one example from the MOCA core indicator set that helps us to understand it at least a little better, and I think there are more to it. But one indicator that we are also tracking ourselves at the Robert Koch Institute is the self-reported health burden due to heat, and we have a very big population representative panel study which is called Gesundheit in Deutschland, and we have one question that really looks into that, and in 2024 almost 30% of the German population self-reported very high or high heat-related health burden. And it just really matters because perceived heat burden directly influences whether individuals adopt protective behaviors and make use of available prevention measures. And I think those two really complement each other. And it's really important to also have more specific data on the national level and on the European level. And with this, I can only thank, firstly, my team that you now see on the slide that helped to put all of this together. And if you want to know more about the project, feel free to scan the QR code or contact us via email. And with this, I'm closing, and thanks again to the Lancet Countdown Europe team.
Thank you, Anka, for this deep dive into the case of Germany. Very interesting to learn about the work at the Robert Koch Institute and how it relates with the Lancet Countdown. And with this example of Germany, we will move to France. And we're very glad to have Frédéric Jourdain with us, the head of the Vector-Borne Diseases Program within the Directorate of Infectious Diseases at Santé Publique France. And you will take us into the world of infectious diseases and will inform us more about how climate change affects infectious diseases in France and what we can learn from your work on preparing and surveying the spread of infectious diseases. Thank you so much for being with us, and we're looking forward to your talk.
So, good afternoon, ladies and gentlemen, and I'm very pleased and honored to take part to this great event. And thank you also to give me the opportunity to share with you an overview of arbovirus surveillance and response in France. And as Max said, it's more related to the impact. So in mainland France, vector-borne disease transmitted by mosquitoes, ticks, sandflies are a growing public health challenge impacted by climate change, as reported in the Lancet Countdown. However, I will focus my talk on 3 specific viruses, dengue, chikungunya, and Zika, that are all sharing the same mosquito vector, Aedes albopictus. So Aedes albopictus, commonly known as the tiger mosquito, is an invasive species that has successfully colonized wide areas, including southern and central Europe, as you can see on the map, with the presence of the species in red. So as underscored by the report of the Lancet Countdown, climate indicators reveal increasing climate suitability and outbreak risks for vector-borne diseases. So let's start by outlining the surveillance and response system implemented in France. So in mainland France, chikungunya and dengue surveillance is based on mandatory notification operating all year round. However, the system is significantly strengthened during the vector active period from May to November. During this period, there is a risk of local transmission. Therefore, it's essential to implement a proactive surveillance system in order to guide risk management strategies. So the response strategy differs depending on whether cases are imported or autochthonous. It means locally acquired. And for imported cases, the primary goal is to reduce the risk of local transmission, and mosquito control is implemented in the areas visited by the individual during the viremic period. In the case of autochthonous cases, it means cases with no travel history. The stakes are even higher. These cases signal local transmission and require an immediate and robust response. So vector control are intensified, and we also conduct active case finding, including door-to-door survey, to identify additional cases. And measures are also implemented to ensure the safety of substances of human origin, and thus to prevent transmission through blood products. So let's turn now to the epidemiological data. Between 2010 and 2024, we identified 53 transmission events involving 277 cases, mostly dengue, with an acceleration between 2022 and 24. So here, each square represents a transmission event with the number, maybe small, but with the number indicating the size of the cluster. And we can make a striking observation here. So we can say that in France today, autochthonous transmission of dengue and chikungunya is no longer an exception. It's the new reality. And today, a year without locally acquired cases would be the outlier. Now, turning to the year 2025, these two figures clearly illustrate the dramatic shift in scale, both in terms of the number of events on the left and the number of cases as shown on the right. The size of these events has varied widely from single cases to large clusters, with 3 events involving over 80 individuals. 8 French regions have been affected, with three regions that had never experienced before any local transmission. So, why is the situation evolving? If we now analyze the situation to identify the key risks factor for the emergence of local transmission events, there is, of course, the presence of the vector, the mosquito, and the expansion of its geographical range over time. So as 2025, it's now 50% of the population, of the French population, which is exposed to Aedes albopictus bites, and then to potential transmission. So the figures show the progression of colonization over the past 2 decades, highlighting the growing risk across the country. Compared, for example, to the entomological situation in 2006, it's the second bar, during the previous huge chikungunya epidemic in the Indian Ocean, and especially in La Réunion. Indeed, another major determinant of risk has been the epidemiological situation in the Indian Ocean in 2025, particularly on Réunion Island, on the left, with over 7,000 confirmed cases in a single week at the peak of the epidemic. So throughout the enhanced surveillance season, a high number of imported cases were reported weekly, as shown on the right, and among them, among the 1,000 imported chikungunya cases, over 80% came from Réunion Island, as shown in yellow. Third major factor, the virus, which was circulating in Réunion Island and regularly introduced in France, is particularly well adapted to Aedes albopictus. Statistical analysis of the different events of transmission allow to identify other drivers associated with local transmission events. These factors include land use, vegetation cover, and seasonal heat accumulation. And from an environmental perspective, residential areas with gardens represent the highest risk zones. And of course, vectors are cold blood animals. They have body temperatures that fluctuate with their environment, and thus they are highly sensitive to temperature changes, and climate variations directly impact their geographic distribution. They extend their seasonal activity, shorten the viral incubation within the vector, and influence vector density, affecting longevity, development time, fecundity, and so on. And then I would like to conclude with a concrete example that is currently a key focus of work. The risk of vector proliferation with urban greening. So, as it was said, we are in an increasingly urban world. 60% of the world population live in an urban area. Vegetation offers undeniable benefits, enhancing biodiversity, improving mental well-being, boosting air quality, and mitigating urban heat islands. However, these green spaces can also create favorable environments for vectors and reservoirs. So the challenge then is how can we support urban greening while minimizing the risk of vector-borne disease. Of course, our goal is not to oppose the positive impact of vegetation against its risk, but rather to foster integrated thinking that leads to a balanced and sustainable solution. So to summarize, the emergence of arbovirus is driven by a combination of ecological, climatic, human, and biological determinants. And the question is what solutions are available? How can we adapt to these global changes? A few years ago, these diseases were considered as tropical, distant. Today, they are knocking at our doors, and Europe must be prepared or pay the price of inaction. Our surveillance system are able to limit its spread. But the system is under pressure. Aedes albopictus is still expanding. Transmission seasons are getting longer, and outbreaks are driven in new areas, driven by global change. And at the same time, resources are not increasing at the same speed. Which means we cannot do everything everywhere. So we need constant adaptation and clear prioritization. So the real shift is not only technical, it's also strategic, strengthening preparedness, improving surveillance, and developing tools for anticipating where and when the next transmission will occur. And finally, this goes beyond public health alone. It must be fully implemented and integrated into broader public policies, from urban planning to water management, as part of a long-term and coherent strategy. Thank you for your attention.
Merci beaucoup, Frédéric, for really zooming into how infectious diseases based on Aedes albopictus spread in France these days already, and I think it was really eye-opening to see how fast this development is happening in France, but all over Europe, really. if we're being honest. And thank you also so much for sharing what can be done against it and what you're doing already. And with this, we will move to the example of Austria before then moving into the panel discussion right after. And it's a great pleasure to introduce Roberta Lichtenecker, the head of the Department of the Competence Center Climate and Health at the Department Climate Neutrality and Sustainable Transformation at Gesundheit Österreich. Since 2022, you're already in that position, and you've been working at the intersection of research, economics, politics for over 30 years with a lot of experience on environmental challenges. And you will be taking us into sustainable healthcare in Austria. So also the responsibility the healthcare system has when it comes to climate change, but also how it's affected at the same time. Thank you for being with us.
Good afternoon, and thank you for the invitation, and it's a great honor to be here and speak about the important topic of greening healthcare system. Let me begin with a picture. Does anybody know where is this? Why am I showing you this picture? This place shows that it is possible to become climate friendly, and it is a sustainable hospital in Schwaz, a small town in Tyrol. Within a few years, they reduced their energy consumption by 50%. They cover 90% of their energy consumption with renewables, and they achieved a major reduction in their carbon footprint. The healthcare sector is both affected by and a contributor to climate change. And the carbon footprint of the healthcare sector is a big one. In Austria, it is 6.7% of the national footprint. And, oops, just it works. CO2 emissions are the main force driving climate change. And climate change has multiple effects on human health. No. Which in turn impacts the healthcare system in different areas, such as patient load, costs, healthcare personnel, working conditions, and resilience. And just 1 second. Okay, something is disappeared. What are the answers to the challenging situation? How can we protect climate and health? And what can we do to create a greener and sustainable healthcare system? Over the last few years, we developed new strategies and innovative projects to support the health system and to reduce the carbon footprint. And there are compelling reasons why the hospital in Schwaz is committed to climate action and sustainability. We can reduce costs for both the healthcare facility and society in general. We can contribute to mitigating the climate crisis, and we can improve supply security. We can create a climate-friendly and health-promoting environment for employees and patients, and we can enhance the attractiveness of the healthcare facilities. And this brings me to what we call the Big Five. Yes, over the last 4 years, we, that is my team and I, developed new strategies and innovative projects to support the health system to reduce the carbon footprint. And now let me share with you the projects and measures. To reach the important target, a net zero healthcare system needs a strategy. Therefore, we developed the National Strategy for a Climate-Neutral Healthcare System with experts and stakeholders. And the primary aim of the strategy is to tackle health services and to reduce their emissions, optimize their efficiency and environmental performance in order to promote the transformation to climate neutrality on a broad basis. And the strategy has a focus on key action fields and framework conditions. The areas are energy, buildings, green spaces, transport and mobility, food system, pharmaceuticals and medical devices, and waste and resources. And for each of these areas, the strategy explains the current situation, why it matters to climate, possible actions, recommendations, and examples of best practice. And to reach the aim of climate neutrality, need a framework which enables the implementation. This means strong governance, involving all relevant stakeholders and decision makers at different levels. It also means providing the right conditions: financing, funding, legal frameworks, research, monitoring, so that climate protection is embedded in the healthcare system and sustainable practices are encouraged and rewarded. In 2024, the National Health Strategy was presented by the Ministers of Health and Climate and Environment and leading experts. You see it on the right side. Let us take a look at the project Climate-Friendly Healthcare Facilities. The major goal is to support healthcare facilities to become green and sustainable and to take full advantage of the benefits. The project includes 3 phases. Firstly, the consultants analyze the data with the employees of the healthcare facility. They take a look at energy consumption, CO2 emissions, and food waste, among other things. They, after the data analysis, they develop a climate action plan with goals and measures. Next, during the implementation phase, the healthcare facility is supported by the consultants. And thirdly, 18 to 24 months later, the consultants carry out a first evaluation regarding the implementation status of the measures from the climate action plan. And if necessary, the climate action plan is adopted. I'm very pleased that 554 healthcare facilities across Austria are participating in the project, including more than 130 hospitals and 155 nursing homes. And together, they are planning over 11,500 climate mitigation measures. 11,500 across areas, you heard it today, such as energy, building, food system, green spaces, resources, procurement, and waste management. The next one is the climate manager training. The course offers a practice-oriented and comprehensive view of climate action in the context of healthcare facilities. The course covers all climate-relevant fields of action and considers the topics of climate protection, climate change, adaptation, and health promoting in an interconnected way. Furthermore, competencies in data collection, monitoring, project process management, communication and public relation, as well as funding for climate action measures are taught. And on the right side, you see a lot of happy participants who have successfully completed the course. I'm excited to introduce the Best Practice Award, which highlights innovative climate mitigation projects in the healthcare sector and encourages other facilities to take action. An expert jury evaluates them based on climate impact, innovation, and health promotion and health benefits. And there are 6 categories, and the top 3 in each category are given awards. And the awards will be proudly presented by Federal State Secretary for Health, Ulrike Königsberger-Ludwig, together with my organization, Gesundheit Österreich. And the goal of the platform, Pioneers of Good Practice in Healthcare Facilities, is to highlight healthcare facilities that stand out through innovation and drive in climate mitigation. These pioneers share best practices and new projects keep the platform growing, and currently 92 facilities are featured, showcasing projects that inspire and motivate others to implement climate action measures in their own institutions. What are the challenges and the barriers to implementing climate mitigation measures in the healthcare sector? Firstly, it is urgent that we raise awareness among the key players. We must speak about the benefits and advantages of climate mitigation. We heard it today: cost reduction, supply security, to create a climate-friendly healthcare surrounding for employees and patients. And we need the commitment of all relevant stakeholders. Who are the key players? Public assurance providers, owners and managers of healthcare facilities, politicians and decision makers. And secondly, the health sector needs a suitable and attractive framework, for example, governance structure, finance, legal framework, monitoring and green deals. We heard it today. And thirdly, it is important to provide and support healthcare facilities, employees and managers with know-how and expertise, how to create a green and sustainable healthcare system. And finally, I want to close with my key message. Climate protection is health protection. Thank you.
Thank you very much, Roberta. I think it's clear that Austria is leading the way when it comes to the responsibility of the, you can stay here right away. Oh, okay. When it comes to the responsibility of the health sector in climate action, and not just being affected, but also taking responsibility to act, to mitigate, and really interesting examples of how that works in practice and the whole consulting program that you have set up. And now we will move to the panel discussion, and I first and foremost invite Raoul Schmidt-Lamontagne to join me here. He has been waiting for a long time now to come up. Thank you for your patience. Thank you for listening to what academia has to say, and we will soon ask you what you make of the facts and findings, but I will introduce the other speakers as well who will join me here. But Raoul Schmidt-Lamontagne is the Deputy Mayor for Climate Protection, Environment and Mobility at the city of Heidelberg since 2020. Before, you were Deputy Mayor for Urban Development, Construction, Transport and Real Estate in Dresden, and you are a true expert when it comes to sustainable urban development, and we're very much looking forward to hearing from you on what Heidelberg is doing. And you will be joined by Frédéric Jourdain here on the stage, by Roberta Lichtenegger, please come up, and Ann-Kathrin von der Haar. And we will start with Raul, and you now patiently listen to the results of the Lancet Countdown on Climate Change and Health Europe report. What do these results mean to the city of Heidelberg?
First of all, thank you very much for the invitation. It was very impressive what you found out with the report, and also the other reports. We've just had a little insight, very interesting for us as a city, and of course, we are like the ones that need to transfer all this into the practical doing every day. So for us, it reassures us in the way what we're doing. We're doing a lot in Heidelberg. Just recently, we had another report which brought us up the climate risk index, which showed us how risky each of the cities and regions within Germany are because of the climate change. And all the cities here within this region were very high in the index, within the top 5. And because we are one of the warmest regions within Germany here in the Rhine-Neckar Valley, we have many risky things like heavy water coming down the steep hills. So we have a lot of things that we have to look at for climate resilience, for climate adaptation, and we have many programs. And of course, those reports are important for our work.
Excellent. What can you give us some more insights on the project that you've already done in Heidelberg? How is Heidelberg adapting?
Well, there's many aspects. Some of them are really linked to the aspect of health. Some others are linked to maybe other aspects. But for example, we have a Heidelberg heat action plan. We have a heavy precipitation, heavy rainfall, and flooding concept. We have a urban climate analysis, which shows us where we have hotspots within the city. We have an urban development concept. It actually has one of the main topics for climate adaptation, which is pretty new. Not many of the urban development concepts within Germany have that. We have actually made a lot of changes in the way we work on free spaces, more trees. We changed the way we work in our forests. We have huge forests surrounding our city. And we have subsidy programs for people, for example, for heavy rainfall, water management, all that kind of things. And then we have, and that maybe links to the health aspect, we have climate adaptation concepts, and we have programs, for example, Oasis, where we try to get rid of concrete and get in trees and stuff like that. So we have many things. And one really new thing, which is really interesting maybe, is we have a climate planning scanner, which means we can look forward before we actually go into the planning process, how the housing, the plans that we are going to build affects the local climate, the microclimate, and can see, for example, where it's good to put maybe sleeping rooms, because for the hot summer nights that the people don't sleep on the hottest front of the house and stuff like that. So we have some instruments that we're trying to implement into our planning processes, and yeah.
Wow, that sounds very advanced, especially the last example that you gave. And we talked a lot about facts and figures and data today. But I imagine it's also really important to motivate citizens, because a lot depends on their behavior, how they act. Which role do narratives, communication, and storytelling play in that regard?
I think it's one of the most important aspects, because, of course, we know a lot. We have many surveys on how climate change is going to have an impact on all of us. And on the other hand, you see in the society that somehow there's a development that scientific research becomes less important and people are believers or non-believers, and it's scientific arguments are discussed in public like religious thesis. So that kind of that's actually a very, very bad trend that we have there. And our way is, or our task for politicians is to get those things that you research into the public and discuss that with the public, which is it's not really easy. And so all those narratives, especially narratives that are developed out of scientific research, are really important for the communications in public.
You mentioned that, just final question, and then I'll ask the others as well, but it's really interesting to hear from the practical examples that you're giving. And you mentioned that findings are being challenged as well, and research, but also the research needs to probably play more of a stronger role as a translator in that regard, the role that you're playing. But what would you ask from researchers like the room full that you have here? What would really help you to make your life easier in translating science into practice?
What really impresses me if scientists, we have some who do that, are able to even bring their research into public, to communicate in public. And we have some really good examples in Germany and Europe who are able to go to a talk show and explain to the people what they found out and how it impacts on to them. Because I think that's what's the most important role. Many people, when you discuss out there, the climate change isn't really, you can't really grip it. It's far away, and the daily struggles, the daily needs for the people, they are closer. And so the problem that is far away and comes somewhere in the future isn't on the daily focus of the people. So we need the researchers, the scientists who are capable to go into a talk show and talk about what they did and bring it to public. I think that's communication is one of the most important things.
Thank you so much for telling this, encouraging all of you to become more active in communication as well, and going to talk shows and really translate science into practice. I think that's really important to hear also. And moving to Roberta, you showed us the examples of how it can work in Austria to make healthcare more sustainable. You showed us this picture of this lovely village in Austria, in Schwarz in Tirol, in the beginning. And what would you say were the key drivers in transitioning the healthcare sector, and what factors also contribute to making sure that it's sustainable, that it can sustain over time and it's not just a one-time project?
Yes, an important factor was the political decision by the Minister of Health in Austria to support the transformation of the healthcare system, and our projects are funded by the Ministry of Health. That's first. And very important, you need a strong network of stakeholders, decision makers, experts, and healthcare employees. Yes, this is very, very important. And you heard it today, the project. You have developed some innovative projects, yes, and the people must see the benefits now, cost reduction, yes, life quality rising, and so on. This is very, very important. And another driving force was and is framework condition. Yes, this is really very important. Also external frameworks like rising oil prices. Yes, resource prices are unstable. Yes, unstable supply chains. Yes, these are all driver for innovation. Yes, and we are a committed and motivated team. And the same we need for the future.
Excellent. Yeah, I think what you mentioned there is also really important, to connect sustainability and climate change to other issues that people are dealing with anyways, and in your case the hospitals are dealing with, so that they understand how that helps them. Speaking of help, we were talking about the launch of a European and international report, and we heard from you, Frédéric, about the facts and figures of infectious diseases, how it spreads in France, and what you're doing against it. How do these more international reports actually help you with your work in France?
So international reports like Lancet Countdown play a key role in supporting national work, I would say, in 3 main ways. First, they legitimize climate change as a health issue by translating it into concrete and measurable health impact. And the use of quantitative indicators is central here. And as they make risks such as vector suitability or transmission risk more tangible and allow to communicate about it beyond expert circles. Second, they offer harmonized indicators, allowing comparisons and supporting the development of national surveillance system. And third, they keep building political engagement and attention and facilitate intersectoral collaboration, linking health with sectors like urban planning or water management that need to integrate multiple risks like vector-borne disease, but also allergy, heat waves, and so on.
Thank you so much. So from what you're saying is we need international, interdisciplinary collaboration to make sure that we're really monitoring and evaluating what's happening so that we can respond and act better. And that's something that, Anka, you also addressed and are working on in your mock-up project. How can we actually ensure that the monitoring systems work, and how can we ensure that we're measuring what needs to be measured, that we're focusing on the right indicators? You showed us the stakeholder approach that you had, but how does it actually work in practice?
That's a very good question, and a really important one, because I think that is absolutely crucial to make sure. And we try to, I think we didn't do it like perfectly, but a few like insights to that is, I think the most important thing is that when you start planning monitoring systems or the indicator development, I think it's important to already include the people that use that data and to include the people that maybe are even the people that collected, that data is collected on, into your research, and to really co-create this, because then you have some kind of like buy-in there already, and people know of the work that you're doing. They know that there will be some report coming out soon, or a visualization on the website will be launched soon, and they know that this will come, and that this ideally is also then really influenced by their practical and political needs, that they have like real world problems. I was just attending a conference the last days where really people from public health agencies working in practice were, and it was super important to just hear what really hinders them in like bringing forward the topic of climate change and health in their work. And I think those are like these conversations that you need to take, and that you really be like in contact with people working not only in research but also in like all the other fields, intersectorally but also interdisciplinary. So I think that was one of the key things that we like had on our mind when we were creating the mock-up project or conceptualizing it.
So it's really important to include the stakeholders already in the design of the research project, the research question. How do you then contribute to the transfer? So what Raoul was also mentioning, we have the science, and then we need the action. What are the key factors that you've learned that contribute to effective implementation then?
Yeah, that's also a very good question, because I think that's the part where it lacks, because we have so much good data, we have so many reports coming out like nearly every day that could inform good climate action. But I do think that data alone, of course, does not drive change. It's about this exact like translation and framing that matters. And a few things that we've learned already, or I think that are important, is if you have the people board in before that, and this is what I was saying before, they would rather also co-produce the framing as well as the messages that needs to be sent outside, so to make it more public. But I also think that it's important to really tailor it to specific audiences. Like if you're in a room full of researchers, you can show mortality figures, but if you're in a room with like the general public or with politicians, they might not really understand those kind of figures. So it's really about like to frame it and to really simplify also the messages you're sending, and I think the Lancet Countdown does a great job there because you already have those 3 key messages, what makes it easy for people to understand what this report with all those pages and different figures and numbers is about, and I think that is really crucial. And one other thing that I feel is crucial is to have people that are trusted, for example, medical practitioners that are in contact with people that we see in studies that are trusted by people, and that can really help to put the message out there. And yeah, and one last thing that I would like to mention is that it's also important, and this is what we're, I think, now doing in the panel, to not only say, okay, this is really, really bad. I mean, the report is showing that, but also have this link to concrete action, to things that are good already. And this is what the Lancet Countdown, I feel like, has been doing the last decade, not only saying, oh, we see so many people dying already or having a burden of climate change, but also see what is good, what is running in the right direction. And I think this like powerful like note on the site is really important to keep people motivated.
With this, we would like to open up the discussion for the audience. If you have any questions here in the room or online, please indicate so in the room by just raising your hand, and then we will join you with a microphone. And if you have questions online, you can just write them in the chat, and then we will read them out. We will start with the first question here. And if you could also tell us who you're referring to the question to.
Sure, thank you very much. Good afternoon, everyone. Anne Stauffer, Health and Environment Alliance. First of all, thank you very much and congratulations to the Lancet Countdown for this excellent report, which is so much needed. The evidence is so much needed also for us as a civil society organization working on EU policies, especially to better protect health. My question is on financing. Because I think we heard in the beginning, we heard on the urgency, the continued urgency to act. I think there's also a great agreement in this room on what's actually needed, the measures that are needed. The challenges at the moment in the times we live in is to secure the financing to be able to do this. And so one invitation from us is for everyone to work actually on the next EU budget, because at the moment there's a really important window to secure a dedicated budget line on health and climate resilience. But it's also a question to the panel. Do you have a recommendation? Do you have an inspiration on how we can mobilize those responsible for finances to actually dedicate money, resources to better protect health?
Thank you for this really important question. Who wants to address the elephant in the room? Where does the money come from? Would you like to start?
Now, I said it, our projects are funded by the Ministry of Health, yes, but it is really very important that I presented it, that our 130 hospitals are participating in the project, yes, and they are committed, and they say it also in the public. They say it why it's important to invest in climate mitigation, yes, because it's the cost reduction and so on. We heard it today, and this is very important. These are the stakeholders, the decision makers that are committed to climate mitigation. And this is really a very important issue for us.
Would someone like to add to that? Yeah, how's Heidelberg doing this? Because you're doing so much on climate action, but I hear that money can also be short sometimes. And how do you make sure that you prioritize?
It's actually a real big issue right now within the city. We're not too good on our budget right now. What we're good in is going to the funding projects. Everything we do right now is funded by European Union, government, and somehow we have some good funding management, and many of the big projects we do right now are only possible because we were at the right spot at the right time with our projects and could reach in those funding appliances, and so a lot of money comes to Heidelberg right now and gives us a good perspective on those projects. On the other hand, we are in a crisis, but when I see where the money is spent sometimes, and that we are spending 1.6 billion right now to subsidize oil prices on the gas stations within 2 months, and on the other hand, we have projects for mobility, for example, where we spend 1.5 billion for a year for the Deutschland ticket. And you look at how the priorities are, then you sometimes think maybe the funding isn't the real problem. It's more the priorities you set within the funding budgets.
Yes, excellent point. Thank you. Are there any further questions in the room or on? I see some online. So, Hedi, we'll start with the one here, and then we will move to the ones online.
Thank you. A question for the Deputy Mayor. One of the observations that we have from the literature is that cities, when they are hosting a very, very strong academic institution, very often they can team up with that, and that adds not only to the glory of the academic institution, but to the prosperity of the community. And I would like to ask you how much of this kind of collaboration exists between the municipality of Heidelberg and this glorious institution, because I suspect that there is a powerful alliance there, and perhaps this is also part of the success that you are seeing in mobilizing resources in a very competitive environment.
Actually, there are some really strong alliances between the university and the city, and it always depends. There's some aspects, some issues, some fields where we have really strong connection and work together on projects and so on. On other things, it could be closer, as it always is. But I think that actually we do a lot of case studies together with the university. They have ideas, they need pilots, and they find a partner in us. Sometimes they go outside of Heidelberg, which is perfectly fine as well. We don't need to be the pilot for every project, for every research project that the University of Heidelberg does. But I think the connection is really strong, and maybe that is one of the matters of success within the region, that we have that strong connection, yes.
Thank you. We have a couple of questions online and still in the room, but we'll start online.
Thank you very much. I have a question for Frederic. You really showcased us the data in France and how the cases in France have been developing. So at first you showed us the slide of 2022 and 2024, and it looked like a really big change in the number of cases. And then you changed the slideshow and you showed us that 2025 appeared to the slide, which made the previous years look really, really small. So I really want to know, could you describe us what was the mood in France in the National Health Institute while this was evolving in 2025, and what was the mood among the public? So what was the emotions that you were observing this change happen?
So, of course, there was a lot of communication during all the season, and many people were aware of a risk maybe they didn't expect before. But on the public health side, it was really a big challenge. Everybody was very busy, and it happens also during the summertime, where resources are also limited by vacation and so on. So I don't know what to add, but it was really a big challenge, and we really hope to not face the same situation this year. The season is starting in 10 days, but the importation pressure seems lower this year than in 2025.
Thank you. We have the next question here in the room.
Thank you. My question, I'm Claudia Schmiedeberg from University of Heidelberg. My question follows up to the issue of financing and priorities. And of course, the adaptation measures regarding health, heat action plans and so on are very important. But do we have the problem that the more we stress the findings regarding adaptation measures, necessary adaptation measures, policymakers prefer these measures to climate change mitigation measures, which might be less popular? And how can we communicate that doing the one doesn't make the other one less important?
Yeah, is there a competition between mitigation and adaptation? You're shaking your head, no? Do you want to comment on that?
In our communication, we are really separating those two things. That's something I really look onto in all of our communication, that we don't mix up climate change or climate protection and climate adaptation. That's something that we really separate from each other. And we're doing that because of that, because the climate adaptation shouldn't be the reason why we don't do climate protection anymore. So we really separate that in communication, and we have an own program for climate adaptation, for all the stuff we do, greening the streets and stuff like that. And then we have all the projects we do for climate protection, for example, building huge heat water pumps and trying to get wind turbines into the city and stuff like that. Those are like the climate protection projects, and then we have the climate adaptation projects, and they have nothing to do with each other.
Maybe connected to that, to Roberta, in Austria, can the need for adaptation actually also be an argument for more mitigation, because we're meeting the limits of adaptation if we're not mitigating enough?
Yes, but you have to see the long run. This is really very important, and also we communicate that climate mitigation is also climate adaptation, insulation of hospitals, yes, green spaces, and so on. There are a lot of things that are all very important for adaptation and mitigation. But I see your problem. And it's difficult.
So it's important that we're adapting sustainably as well. And I see the next questions are online.
So there's a question online regarding the greening of schools. Are you aware of any initiatives besides the one in Paris? It's a public health measure that seems easy to implement and offers many additional benefits.
Thank you. Any further examples of greening of schools? Is that happening in Heidelberg already?
We do have some projects where we try to get concrete out of the school grounds and bring in trees. We actually, it's funny because we had some conflicts in the past. We had schools where we want to make the surrounding of the school green, and then they were like the ones who run the school. They were like, oh no, then all the dirt is they're gonna run over the playground and bring in all the dirt, and then we have all the cleaning issues. But we are over that by now, and we're trying to green all the schools as well. But it's not always that easy as it seems. But yeah, we have some pilots trying to do that.
And I hear there are even some kindergartens and schools that are completely in the forest these days, no? That's a
we do have that as well, that's true. We have some kindergartens who only have like little camping wagons and are in the forest the whole day. But that's not the common. It's only single ones. Yeah.
And you wanted to comment on that as well?
In Austria, we have pilot projects and also schools and kindergartens, yes, that are sustainable and green. But it's very important that you have a strategy. Yes, therefore we developed the strategy for the healthcare system, and you need also a strategy for other areas, like the school system.
Strategy is essential. We have more questions online. If they are in the room also, please just indicate so.
All right, I have a question for you, Roberta. You mentioned that within the strategy you now have more than 11,000 individual measures which you can recommend. And I personally think that Austrian healthcare sector transition should really be an international success story. And my question is, could you highlight some of the individual measures and their measurable cost-cutting effects in hospitals that we could take as an examples with us and spread this information? Thank you.
Thank you for the success story. We like it. Yes, we now are working on the evaluation, yes, and I think in 3 months we can also show cases about the costs and the benefits in terms. Yes.
Thank you so much.
Excellent. Are there any further questions in the room? Yes, we have one over here.
Thank you. I'm a lecturer and teacher from Austria, and I would actually like to ask a question to the presenter of the Lancet, if I may. Is that allowed? Thank you.
If they can answer.
Because they're not standing there, so I have to ask. I'm very interested in the indicators regarding health literacy of health professionals. And as I'm a lecturer in an applied university, I would actually like to understand why allied health professionals are not part of the indicators, because I see, for example, nurses, but also other allied health professionals, and the changes we have in the curriculum as being a very important target group. And I feel that not only for the Lancet, it would be a plus to add these indicators, but also for this target group, it would be a very important message to be seen. Thank you.
So we're going to pass the mic to our research fellows. Yeah.
Yes, thank you for the question. So I'm Hedy Creed. I'm the first author of the report. We do have discussion with ASPER about getting this indicator within the report. This is part of the 2024 Lancet Countdown Global Report. So we have some data there, but to have this kind of data across Europe is very hard to get. But we are working on this, so hopefully in the future editions we will be able to include this. Thank you for the question.
Thank you for the question and the sneak peek into the future. Are there any further questions in the room at this point? If not, maybe there are some online. Yes, here's another question.
As you pointed out that communication is key in this kind of field, I was wondering, is it like a communication strategy where you say, okay, because we're talking about national success stories, it's very positive. So was it like from doing like a panic message towards more an optimistic, positive message to get their attention and to move people? The question is for like the panel.
Yes, who wants to answer what is the most effective communication strategy? Greta Thunberg said she wants us to panic. Others say that we need to be optimistic and show what works. What are the success stories?
I think I raised a few points earlier, but I feel like it always depends on who you're talking to. And I feel like sometimes those like really threatening messages do work for people to feel motivated or to like have enough like panic or energy with them to really trigger change. But what I see is that also like this positive visions of how can we actually live together, how can we make sure that we have a good community that is not only related to climate change but also to other aspects in our social daily life together, that really works. And really, I think someone said that climate change is really abstract and people don't feel like that it's there already and can't really connect it to their daily life. And I think like all those small examples that you can really relate to help to make sure that people really feel that this is an issue that they have to take action on, and that really happens in their life as well.
You wanted to add?
You're addressing a really important issue, communication and public relations. Yes, therefore we have the Best Practice Award to see that it's possible to take action. Yes, and I want to give you some example for the Best Practice Award. First, a pharmacy installed solar panels and a battery to keep medicines cool for 5 days during a blackout. Yes, this is a great thing. Not a diesel generator. Yes, it's the next thing for the future. Or a doctor pays the bus ticket if patients come by bus instead of by car. Or a clinic for children with cancer created a garden to help them recover better. Yes, and that's important to show in the public.
Excellent, thank you. Are there any further questions at this point? Yes.
Thank you. I'm Marie from the Center for Planetary Health Policy, and I also have a question regarding the experiences of Austria. So since you mentioned that the Ministry of Health is financing your great projects, I was wondering, how did you get them to finance it?
This is a good question. It was an idea, and then an idea about the package. You heard it today. Best Practice Awards, strategy, climate-friendly healthcare facilities, the platform. And that convinced him that it is a strategy for the future. Yes, and to see the long run, cost reduction, better life quality and so on. And we are really grateful that it is possible to realize these projects in Austria.
Okay. Thank you. Any further questions? Yes.
So there's a question from the Belgium team who's watching us online. What would be the most important message to convey to our political leaders?
You want to answer?
What would be the most? I mean, I'm still at the communication point, and maybe that connects really well. I think you can't make like a general plan for how communication has to work, and sometimes something happens, worldwide crisis, and you see, okay, that kind of works together with the climate crisis as well. But what I think what we see is we had those years in the past where, I mean, you mentioned Greta Thunberg, where, let's face it, the Friday for Future movement changed a lot in public communication, in public reception, and the pressure from the street actually moved politicians. And somehow this kind of died off over the last years. The whole issue of climate change, climate adaptation as well, didn't become the main topic in public anymore, and somehow that's missing. But I think the central message is it's still an issue, even though the kids are not on the streets anymore. And I think that's maybe one of the main topics you should bring to the big politicians as well.
Excellent point. If there are no further questions at this time, okay, the final question. No pressure.
I don't know if it's really a question, it's maybe more a comment. I find it extremely interesting that when we try to argue for the topics we have here in the room, we always go back to financing. And it's somehow maybe questionable if that is the right answer. I'm coming originally from health promotion. 40 years ago, we've done exactly the same thing. And I wonder if we were successful with this. And it's interesting to see that no one in the room argues with quality of life and resilience as a society. So we might have to change a little bit direction. You know, I don't know, you know, and I have an answer. But and the other thing I wanted to say is I find it very interesting that we are still at the point of separating mitigation and adaptation in our arguments. And I would give this small recommendation to Heidelberg to change that, to not separate these two pots, because they really work together and they belong together and they can only be argued together, in my opinion. Humble.
Thank you very much. Would someone like to comment on that?
Just a quick answer. Why do we separate it? I'm fearing, and that's actually what happens sometimes in political discussions, is that people think, let's make the climate adaptation, the problem is gone. And that's why we separate and say stopping the climate change is still a major issue. And the climate adaptation, yeah, we need to do that because we know the climate's going to change, but it's not going to solve the general problem. So that's why we separate it. I know it works together in many projects, and of course, planting a tree instead of a concrete street makes a difference, but it's not going to save the planet. It's going to make the livability in the city higher. It's going to make do something for the microclimate, but it's not going to save the planet. But to save the planet, we need to do different things. That's why we separate it and say it's not the same thing. And we're not going to solve the problem if we just make climate adaptation and plant some trees in the streets. That's the main reason.
Thank you. I think we can also continue this discussion later on after the event. Thank you so much for all of the great questions, and thank you so much for your patience, for joining us today. Thank you to the great panelists and keynote speakers. It's really been a pleasure to learn from you, and thank you to the Lancet Countdown team, and a special thank you to welcome the UCL colleagues from the global team, especially Hannah Whitcomb, Manur Said, and Alan Connor. And we would like to thank the Lancet Public Health editorial team and independent reviewers, and also the Heidelberg University Communications team for their support, and Jan Käse. And for some final remarks, I would like to hand it to Joachim Rockliff. Thank you.
I'll be very brief. We also want to thank you, Max. Excellent moderation. In addition, I wanted to just thank the people who has contributed to the Countdown report, and there are many of them in the room. So if you contributed to Countdown report, can you stand up so we can see you? I know there is many, there is more, yeah. There should be more, okay. There is also here, Josie. Thank you for your contributions. Captain, do you want to go? There is also two people who's been really important for the whole report. In addition to Catherine and me, who's been helping out with the leadership and contributing in our way. But Jose and Hedy, can you please come up on the in front here? You really deserve, I think, a big thank you. You've done a huge amount of work in preparing this, and I must say, I think the keynotes and the panel discussion was exceptionally interesting today. So thank you for organizing everything. Thank you for your contributions. And now this is it. We have refreshments, maybe?
Yes, thank you for coming. So if you want to stay, we have at Pelletage some refreshments, snacks and drinks. And if you can stay and talk with the scientists or ask questions, our panelists, you are welcome to do that. So thank you all for coming.